Welcome to Beyond the Treatment, brought to you by Checkatreatment. I'm Tallulah Hedges and we're joined here today with Joanna Osborne, Psychotherapist and EMDR Practitioner, to talk about EMDR therapy. So Joanna, can you tell us what is EMDR therapy and how does it differ from traditional talking therapy?
Yeah, so EMDR therapy is a treatment. It's primarily known for trauma. And it differs in the fact that there are less words in EMDR therapy, so people don't need to talk as much.
Okay.
It's much more of a kind of internal processing. So the way that we understand EMDR is when we go through a traumatic experience, it can overwhelm our brains and our systems, and so quite often then we don't get to process and memories get stuck, and that's why sometimes we can be reliving and having, being hypervigilant. And so what EMDR does is it goes back into the memory with a trained professional so that those memories can be filed away properly, and then in doing that process you'll always remember that memory, but you won't be distressed by it when you remember it.
Okay, so talking about then memories and being stuck and having a detrimental or negative sensation or response in the present, would you say then that EMDR therapy is particularly beneficial for those sort of dealing with trauma, PTSD? What would you say, or who would you say benefits the most from having EMDR therapy?
Yeah, so it's an evidence-based therapy, so it's recommended by, the WHO Health Organisation or the World Health Organisation, NICE guidelines who recommend to the NHS. So it's known particularly for complex PTSD and PTSD, so it's particularly recommended for that client group, although we do use it for other situations as well.
Okay, and so for our viewers, so EMDR stands for Eye Movement Desensitisation and Reprocessing, just for those who didn't know. Okay, so can you talk us through what a typical session of EMDR therapy looks like?
Yeah, so it differs according to where you are in the stage. So first of all would be kind of the history taking, getting to know the person, what their difficulties are. And in that you're really particularly listening out for events that have been traumatic and how that might be experiencing, or the patient might be experiencing that in the here and now. So, and then through that you would be, target planning, thinking about, how does it impact on you, how is it triggering, and where do we need to go? And then once we've got all of that information, and when we've done lots of preparation and resourcing, which is a really important part of EMDR as well, we don't get straight in. Then we move on to, what we call the desensitisation process. So then I'll be asking them about the memory, about the beliefs that they might have that go along with that, particularly difficult images, emotions, body sensations. And then we just together, start working through and activating that. So, and the nervous system has an amazing system where we respect where the brain needs to go and how it needs to heal. And I'm just here when people get stuck and helping them through.
Okay,
going through that.
And with EMDR therapy, so you have these wonderful apparatus. Can you talk us through what these things are? So
absolutely. So say for example, if you're coming to me with a trauma, so I'll be asking you things like, what's the image that goes with that? What are you believing about yourself? What would you prefer to believe about yourself? Where are you feeling it in your body? The emotions? How distressing is it? Not necessarily in that order, but that's what we'll go through. And then once we've got all of that information, we put on these kind of maybe just a light bar for some people.
So this is called a light bar,
so this is a light bar.
Okay.
So it's all bilateral stimulation.
Okay. And bilateral stimulation, we're talking about the eyes moving from side to side.
Yeah, so just like REM sleep, when we're sleeping and our eyes are rapidly moving, this is simulating that for people. So as they're remembering the trauma, and maybe Tallulah, they just, they're looking at the light, I'll be alongside that and I'll just say, hold all of those things together and just go with that. And then we'll put on the light bar and you can see there, and the person's eyes will follow that light. And then that will be on for around 30 seconds, something like that. And then I'll stop it and then I'll just say, what are you getting now?
Okay.
So some people will just use the light bar, and that's okay. Some people like to use pulses. So here I'll just show you and demonstrate.
Okay, so pulses here, we've got these two handheld, so they're called pulses, handheld,
That's
what do you call these?
They're just called pulses.
Pulses, right, okay.
Yeah, and then if you were in a session, again, we would want everything to be going to the left at the same time and everything to go to the right. So we're just keeping that bilateral stimulation. So you'll just feel some sensations here.
So then these two pulses, they vibrate quite harshly, so you can feel them.
Yeah.
So then, so the concept of this then, Joanna, so whilst you're reliving the traumatic memory, you're going to have the stimuli from the bilateral stimulation, so the eye movement, then you're going to have the pulse differentiation, so that kind of sensation.
Yeah.
And then also...
And then you can also have headphones.
Okay.
And so what this is also doing is it's keeping you in the here and now.
Okay.
So with EMDR, we understand about, dual awareness. So you've got one foot in the past, but you've also just got one foot in the present, because actually what you've been through is over now. And so it's important that we remember that.
Yes.
So it's keeping you very present, very focused, and it's also taxing your working memory. So here, again, you would have headphones if you choose to. We tailor it to each person.
And it would be
which
so funny if I
stimulation.
put like some heavy metal on right now. So what would
so people can use music,
yeah.
but if we were using music, we would be using it, so it's bilateral stimulation. But within these headphones, you'll notice in a minute you're here and it will just beep from one ear to the other.
Okay, so just to describe what I'm hearing now, it's just like a little beeping sound. So I've got the pulses going on, the vibration of the pulses, I've got a boop, boop going on in either ear, and then I'll be looking at the sound bar. Okay, and then would you say, right, I'm just going to...
Yeah,
just so I can
that
concentrate.
off.
So talking about contraindications then, so contraindications, viewers, is reasons, it's a term that's used in healthcare, and it would be reasons why a particular treatment isn't beneficial for a certain individual or groups of individuals. So contraindications for EMDR therapy, what would you say they are, if there are any?
Well, I wouldn't say there are many.
Okay.
But I would say if we are opening up really, really distressing experiences,
Yeah.
we really need to make sure that people are in a kind of safe resource space to do that.
Okay.
But having said that as well, in the first kind of stages of EMDR, we do lots and lots of resourcing. So, really looking to stabilise before we go into opening up more things, just because our nervous systems, are bringing up difficult experiences. And so we need to kind of really widen people's ability to be able to cope with being able to handle that.
So I'm curious as well, so how about individuals living with conditions such as bipolar disorder or sort of personality disorders, schizophrenia? Would EMDR be okay, beneficial? Would you kind of say that it's okay for individuals living with such conditions?
Well, there's a professor, I think he's a professor called Paul Miller, who's written a book about EMDR for psychosis.
Oh, okay.
And so it is being used more in early intervention teams now. So I think, people are making it more and more accessible to many, many different client groups.
Amazing. And how about, talking about client groups, how about different age groups? So what age would you say that this particular EMDR setup would be beneficial for, and children, how would you kind of differentiate between those different age groups?
Well, I would say EMDR is absolutely brilliant for children, because children often don't have the words to be able to verbalise what they've been through. And one of the other differences of EMDR therapy from other therapies is that people use less words. It's less word-based, it's more internal processing and restoring memories within our nervous system. So I would say any age group, really, it would be suitable for.
And I'm thinking as well, those living with conditions such as ADHD, EMDR therapy may be particularly beneficial because of all the different stimuli that you've got going on. Would you agree?
Yeah, I've worked a lot with clients with ADHD, and again, we might tailor it so people might need to sort of write notes to help them remember, so we can stop, we can pause, we can do that. But people have used it really, really successfully, done amazing work.
And how about those living with autism? Would you say, have you found that those living with autism do they cope okay with the stimuli? Have you worked with that client group before?
Yes, I have. Yeah, again, so we do tailor it. Sometimes people can find, some things too much. And so, with one client, I had it where she was kind of literally moving slime because she could like the texture of it from one hand to another. Sometimes people don't have visual images in the same way.
Yes.
So we might use words that they see rather than a picture. So again, it's really finding out with each client and adapting, EMDR to
That's
fit.
right, and the word you use there, tailoring as well. So tailoring it to each individual. So if somebody comes and then the light might make them feel nauseous, or it might give them a headache. So you could just tailor it. You don't have to use this equipment. It's all about focus into those individual needs of your particular client or patient.
Yeah, absolutely. So for someone looking at the light bar, they might find, they can't access the memory in the same way. So, I've got some clients who they'll hold pulses and have the headphones on and actually close their eyes to be able to access it. For other people who are maybe feeling flooded and it's just all coming in too much, the light bar can be really helpful in just really keeping people present and managing the images. So it's just working out according to the person.
Amazing. So I know it's difficult to say sort of how long's a piece of string. Is there kind of a general guideline of how many sessions one may need, or is it just that's too much of a difficult question to ask?
Well, I think first of all asking the person what they want and where they are, but in terms of typical kind of numbers, I guess for a single incident you're looking at maybe 12 to 16 sessions.
Yeah.
With complex trauma, maybe around 20 to 24. If someone's grown up with, lots and lots of interpersonal violence, then, maybe they might need longer, or if you need more of a period of stability. But that's kind of around the averages, I would say.
Absolutely. Okay. And final words then, if anybody's considering accessing EMDR therapy, what would your words of advice be for them?
I would say go for it, because I've seen people transform and heal over things that have happened to them sometimes decades before. So it's never too late. It's evidence-based. And just find someone who's accredited in EMDR. I would say give it a go.
Amazing. Joanna, thank you so much for your time today. Checkatreatment, over to you. Woo!